Hello, people. This is Dr. Sudarshan, Medical Officer at Miracle. So, I think last episode it was very interesting to know what are the different approaches that we do here in Miracle, especially with integrative approaches, the way we target cancer, what kind of therapies we use here. So, today we are into yet another brand new episode where we'll discuss about some successful stories that we have dealt in Miracle. So, with us we have our Chief Medical Officer, Dr. Pradeep. We welcome you, sir. In the previous episode, it was very clear that how Miracle views cancer, the metabolic approaches, the way you treat here at Miracle. So, have you ever come across some challenging cases? Any successful stories involved in this, sir?
Yeah, so obviously at Miracle, the cases we treat are very challenging because most of the time people only come to integrative oncology approaches after they exhaust all other options what they have in their front. So we got a typical case of CA urinary bladder, carcinoma of bladder, and which was metastasized to their prostate and bones, and there were some lymph nodes which was involved. This old man, he was initially treated in one of a renowned hospital down south, and he has been put on a palliative chemotherapy. That means the chemotherapy which are given to just maintain their life or pain. So he came to us because the palliative chemotherapy he could not tolerate, and there were a lot of side effects associated with that. And he was given some 3 or 4 months to leave because he was not even tolerating palliative chemotherapy. So he came to us with the diagnosis of this multiple metastasis. I remember he came on a wheelchair to us with lot of pain. He could not stand. There was pain in the bones, and there was hematuria. That is, he was passing blood through the urine. So these are the conditions with which he came. And with our approach in 9 months, it was like we could able to bring him back to life. Not only we reinitiated a certain oral chemotherapy, but also we could successfully bring him back to the life.
So, as you said, of course, this is very fascinating to listen because, he's been having a lot of metastasis. It is, of course, above stage 3 and all. So, but from patient point of view, so when they come to you at first consultation, so what is that one common question they are looking for? And they are definitely, when there is something, they're going to try something new. They have this, doubtfulness whether this is going to work or not. How do you, manage with that, sir?
So this particular patient, if you see, so they came to us because there is nothing that they believe it could help him in terms of, because they have exhausted all the other options, as I told earlier. So initially they came to us just for looking into an option where we can keep him pain free and his quality of life can be managed. But at Miracle, two things we disagree is, one is about the palliative care altogether. So it is like the palliative care means the end of imagination, like as per my perspective, because whenever there is no drugs available to see a possible cure or healing for the patient, we put him in on a possible comfort zone. That is what is palliative care. So at Miracle, for every patient, even there is a 2% chance, we try and fight in that 2%, and we try and rebuild that and bring him back to the life. Second thing, what we disagree is about a staging of tumor. So staging of tumor is also, again, when you cannot put too many drugs on the patient, we put them on stage 4 and we'll again initiate a palliative care for that particular patient. So both these things we don't consider. So even though the patient came to us with an expectation of, can we do something with respect to his pain, or he is able to manage his life till whatever time it is left for him. But we looked with our Miracle perspective, where we initially tried and understood what are the things which is wrong in him. Like, so his PSA, the prostate specific antigen levels, were really high when he came to us, and his ALP, alkaline phosphatase, which we look for, the bone metastasis was also high when he came to us, and he was in a total distress. So initial challenge of me was to make a patient believe that he's not going to die, because when you get a diagnosis of cancer, all we believe is like, okay, I'm anyway going to die. What are my chances to survive? Is 20%, 30%? But at Miracle, we don't look in that way. Like, we look in a way that, okay, so this person has got a condition, but it is more of a metabolic origin, even though there is a genetic mutation happening in this particular patient. So we took this patient, we convinced and counseled the patient, their bystanders, because more than the pressure of the patient, the pressure of the family is too much. Their anxiety, their expectations from a doctor will be too much. And especially running an integrative oncology stuff is not that easy, like, because the patient get to ask a lot of questions. Unlike a conventional setting, you speak for 2 minutes and only thing you're treating the scans and the patient's body per se. Whereas here in integrative oncology, we have to treat beyond the scans. We have to reach out to the patient's mind. What is his feeling about the diagnosis altogether? Is he positive enough to survive? So these are the strategies which we need to build in the initial consultation. So once we could make the patient believe uh, beyond his conventional perspectives about tumor, he kind of convinced, okay, let me try this. So that is a state where we started with this particular patient.
Nice, sir. Nice. It is more of rewiring somebody's belief system because death is, of course, inevitable. It is not that only cancer has to kill me. Even if I don't get cancer, I will definitely die one day. That is the basic of this. It's just wonderful. At the same time, sir, as you said, the family's peer pressure on you, saying that how will this go? How will this work? And with all of this, and with people, the medical fraternity demanding more of research into your, the therapies that you give, and you being a person who has published somewhere around 80 plus papers, if I'm not wrong, in reputed journals. How do you tackle these kind of questions, sir, whenever they are asking you about the evidences that you do in Miracle? So what do you do with that, sir?
So in Miracle, one of the fortunate thing is different medical streams working together. So when we offer integrative oncology, it doesn't mean that we are against modern medicine system. That is one of the prime comment I want to make. So we have a medical oncologist in our team. We have a general physician in our team. So when this patient came to us, he was on palliative care, which he could not tolerate. Our primary aim was to stabilize this patient in a way that he can undergo chemotherapy if at all necessary. So we were in constant touch with our medical oncologist where he guided us in terms of, okay, at this point of time, I agree with your point. So we have put him on a lot of nutrition. We have put him on our standalone, one of its kind treatment, oncothermia. Then we have given him micronutrients correction, which was depleted in his body. And 6 months we traveled with him by providing such kind of support. And also periodically we monitored his PET scans or CT scans we have been taking. And we were finding that disease has started partially responding to our treatment. And then it came a time at the 6th month, like when he started with us. At the 6th month, we believe that he's now good enough because from wheelchair, he started walking. From staying as an inpatient for 24 days, he started coming as an outpatient and his food intake become better. His PSA level started responding really well. At that point of time, we realized that, okay, now our medical oncologist has stepped in. So instead of giving a intravenous chemotherapy, which was initially planned during his palliative care, we started integrating with tyrosine kinase inhibitors. Those are oral chemotherapy drugs, which our oncologist integrated with this. And from 6th month to 9th month, he was taking a combination therapy. And that is the beauty of integrative approaches. So you're not denying the patient anything, if at all chemo is required, we can really integrate it well. And it is not necessarily, it should be always intravenous high dose chemos. We can go for a low dose chemo. This luxury you can get only if you provide a nice environment for the body to respond, a nice environment for the body to tolerate. So the story goes like this from 6th month to 9th month when things were combined together. On the 9th month, from the day we started treating with that patient, the PET scan came complete metabolic remission. And then we did not stop there. We continued with the oral chemo drug, and he continued to visit us once in a month as an outpatient, where we integrated high dose vitamin C, ozone therapies, and he was on a complete diet for this entire 9th month. Then we repeated the PET scan on the 12th month. It was a complete metabolic response. He repeated on the again 15th month. From the 9th month, we achieved a remission. It is still is going good with a complete remission. So this is a story of resilience when you see from palliative care as a no option patient at the age of 75, he walked back to life. So that is how things can change, and that builds a lot of confidence for me as a professional who are handling, and my team, of course, who are there with me. As like we can, anything can be beatable, rewired, brought back if we are providing the right environment. So integrative oncology is such a thing which provides such kind of luxury for even those patients who have no option left to live.
This wonderful, wonderful explanation, and it's actually motivating also. And people often, misconception misunderstand that, they think this is also a part of alternative therapy, which is not. And as you said, you need a team of doctors, who join hands together to treat somebody. And it's been a very long journey. People think that, in today's world, everybody wanted some faster cures. When they come to you, how long will it take? That is the question. But I think partially we need patients' input also in here, if I'm not wrong. Even their input is also very much important, sir. So now that being said, so how did the patient feel? What was his perspectives through because he had to travel a long way, like 9 months, a year. What was his point of view?
Like, so without the patient's support or belief, we cannot run this kind of ideology. So this patient, I always remember in the consultations, whenever he come to me, he asked me one question: can I have a cup of tea? Can I have a cup of coffee? So that is the goal which he has set for himself. Like, because when you look into cancer care, most of the time you just trust the hospital doctors. You are ready, 21 days, you go once, you put an IV and go back, have your rice, have your milk, have your meat, you enjoy your life and expect the cancer to go. And here, what we are doing as a patient, nothing. You're just spending money and lying down and taking a chemotherapy. Whereas in integrative oncology, it is not the same thing. Here, the responsibility of healing, 60% lies on the patient. So the self-discipline is very, very important in terms of that. Like, even for all of us, for that matter, this patient was a really disciplined patient. Like, he got rid of his tea addiction, milk addiction, sugar addiction. So it was a challenging journey for him. But what was encouraging him was the results. Imagine a patient on wheelchair, standing, walking, doing his things, building his house, doing his chores without a fear. That is something we can never see in a cancer ward or a cancer hospital. So that is something which was really motivating. And the patient perspective was always about, now I'm feeling very normal when I can start the so-called normal things. But there is nothing called normal. It is about being disciplined. But of course, you can enjoy your tea or vada at some time. But there should be again a bouncing back and being very disciplined.
Yes, that's, and you said this is a very long journey, and the motivation of the patient also is very important. So if suppose now the patient is completely fine, but as you said, discipline is important. Is there any chances for relapse, sir? If, as you said, it is all about discipline of the patient also, as is there any chance of relapse in here, sir, in future, near future? And for that, do we need any long-term follow-up and all?
See, cancer is always there. It is not like only you are not seeing in the scan at that point of time. Only thing we should remember is about um, the self-discipline is something which always required, even if you do not have a diagnosis. How much to indulge, what to indulge. So these things we need to really have in mind when we are going through any condition, not just for cancer, for every condition. So relapse, when you're self-disciplines, you're reducing 70% of your chance to get a relapse. Whereas 30% you are living in the same world where there is radiation, there is pesticides, there is environmental pollution, and so many things which adds. That is 30% of cancer's origin. But 70% is a big number we can offer to a patient. Okay, 70% of time you're not going to get it back. So that is something a self-discipline can offer.
Okay, that is so nice. And in terms of palliative care, that is a term outside of Miracle. Miracle care is more important, I think. And for any people who think there is, they have met the threshold or the, seal of some treatment, I think Miracle opens the door there. So does this mean any palliative care? You said this earlier. Any palliative care. For this case, this is, I think, a bladder case, bladder with bone metastasis. So anybody can, I think, go through this if they are willing, if they are having that mental power, and if they are convenient with the therapies. Once the doctor, like, this start from the first consultation itself. So I think this opens the door also. So you wanted to.
Correct. So palliative care is not the end. So that is the thing which we always has to believe. So palliative care, okay, you have exhausted one option from one system of medicine, but there are many systems of medicines, many type of approaches which are available. And Miracle Integrated Health Center is one of its kind where we don't say no to any of the systems of medicine or any type of approaches, provided it is patient centric, and we try and mix up all the kind of possible right combinations with the patient centered approach as the goal at the large.
Thank you very much. And that, summed up the entire protocol, what do you do in Miracle, and your different approaches. Actually fascinating. And of course, I think for the people who are seeing, I think this should be a motivating story also. Of course, there are a lot of challenges. I think by now people should have understood that. even the palliative, so-called palliative care is not something that you need to worry of. And I think people here in Mirakle can definitely help you, but of course, your own willpower also. So stay tuned for more update. Thank you.